The following information has been developed by the Blue Heron Academy of Healing Arts and Sciences, one of the nation's leading schools of massage therapy, complementary and alternative medicine, in conjunction with the American Medical Massage Association. Professional ethics is a critical area of massage practice. The massage therapist makes vital ethical decisions on a daily basis related to their professional conduct and to the care of their patients. We hope that the information provided in this course will assist you with the safe and effective care of your patients. Welcome to this presentation on professional ethics and law for the medical massage therapist. My name is Sandra Bovee, and for the next few minutes, we're going to talk about professional ethics. The purpose of this course in massage and healthcare ethics is to impress upon you the importance of developing a clear understanding of the ethics of caring and to stimulate and provoke thought and self-exploration regarding your own professional and personal ethics. Within the construct of this presentation, and in an engaging and provocative format, you will learn to differentiate between ethics, laws, and etiquette as a practical way of developing and maintaining your professional massage practice. Establish guidelines for professional boundaries and ethics. Identify personal issues and vulnerabilities to unethical behavior. Recognize the special needs of clients and problem behavior. Select appropriate actions that demonstrate professional responsibility relating to unethical, illegal behaviors, both in yourself, your peers, patients, and clients. Avoid ethics violations and the consequences of such behavior. And reduce the risk of civil and legal actions taken against you. It is our hope that you will gain an awareness of the gift you give yourself, your clients, and the massage profession when principles of conduct and character are clearly established and practiced. It is important for you to understand that how you conduct yourself professionally and in regards to the safety and protection of your clients or patients is well established in all states, and that the massage therapist is held to the same standards of professional ethics and laws as every other healthcare provider. There are many personal, family, social, and legal consequences to abusing the trust of a patient or client. This presentation on professional ethics will attempt to define law, etiquette, and ethics. Laws are formulated to restrain the behavior and actions of individuals in society who might cause harm to others. Breaking the law commonly results in fines and/or imprisonment. An example of a violation of the law that would result in such action against a massage therapist would be a therapist who has sex with a client or patient. Etiquette is the social behavior that establishes common and customary interaction in a social environment. The result of improper or impolite behavior usually results in social criticism or ostracism. Ethics are the professional rules that groups develop to define acceptable behavior within the context of their professional functions and activities. Professional ethics are standards that provide a framework for professional conduct. Let's begin our journey into the exploration of professional ethics in the practice of massage therapy with two important documents: the Statement of Professional Unity for Massage Therapists and the Ethical Code of the American Medical Massage Association. These two documents clearly and concisely define our professional standards of ethics and conduct. Let's listen to what these documents have to say to us. First, the Statement of Professional Unity. To all other massage therapists, I say this: you are my brother and my sister in massage. Although we may come from different paths to this sacred art of healing massage, I welcome you to both this art and profession. I recognize the beauty of your healing hands. I celebrate the unity within our diversity. I see richness and reward in our sharing of knowledge and experience. As you are my brother or sister in massage, I will uplift you. If you are alone, I will be your friend. If you need my assistance, without hesitation, I will support you. If you are broken, I will mend you. To those that speak against you, I will arise to defend you. If you need my good counsel or teaching, it is yours. If you are unable to pay for my succor, you will not need to, for I will stand by your side regardless. I will reach out to uplift you regardless. I will open my arms to you regardless. May we never forget that we are more alike than different. May we always recognize our most vital bond through this healing art. May we always realize that if there is a time for healing between us, that time is now, and it is always. For if the healers are not reconciled among themselves, from where will healing come? This document was written by Dr. Gregory T. Lawton and was given as a gift to the massage profession to help unify the profession and to help reduce and eliminate the seemingly constant bickering and contention within the massage profession. Our conduct with our peers, from therapist to therapist, and from massage association to massage association, is also part of our professional ethics and defines each of us as an ethical massage therapist. The next important document is the American Medical Massage Association's Code of Ethical Conduct for its members, and it requires the members of the AMMA to uphold the following. As a professional or associate member of the American Manual Medicine Association, I agree to observe and to practice the following ethical code. I will respect the rights, dignity, and person of each patient. I will render to each patient the highest quality of care, and I will make appropriate and timely referrals to medical providers and/or healthcare professionals. I will accept and treat all those seeking my services without prejudice or discrimination. I will not discriminate against any other healthcare professional simply because we belong to different medical or healthcare professions or possess different healthcare skills. I will keep accurate health and medical records, and I will respect the confidentiality of those records and any other personal information that I receive from a patient. I will educate my patients, and I will explain treatments and clinical responses and avoid making exaggerated promises regarding the care that I provide. I will work to uplift the standards and conduct of the profession. I will maintain the highest standards regarding the advertising of my professional practice and in its presentation to the public. I will use appropriate legal and professional avenues to report ethical practice violations. I will maintain the highest standard of ethical and professional practice for the direct benefit of my patients and the profession. I will obey any and all healthcare rules, statutes, and regulations that pertain to the practice of my profession, and I will observe and practice the highest level of professional ethical conduct. Well, doesn't this just about sum up the entire definition of ethical behavior as a massage therapist? A massage therapist, like other professional healthcare providers, assumes a position of trust with their client or patient. It is vitally important that that position of trust is not violated. Defining ethics in massage therapy. The definition of ethics in massage therapy may begin with our understanding of the purpose of massage and the type of massage that we practice. For example, a medical massage therapist treating patient conditions and diseases will have a different ethical framework than a relaxation massage therapist working in a salon or spa. Why? There are a number of practical reasons. One example is that the medical massage therapist will practice surgical patient draping procedures that involve only exposing the area or region of treatment. The patient will not have to be completely disrobed. Adversely, the relaxation massage therapist may provide a relaxing or sensual massage to a disrobed client. This difference in patient dress or undress, draping, and the use of oil with relaxation massage strokes creates an entirely different therapist-client or patient dynamic during treatment. It is important to understand the differences between relaxation massage and medical massage when it comes to client or patient preparation and the delivery of therapy. Medical massage therapy is emerging as a manual medicine system of treatment that addresses the needs of a rehabilitation therapy environment. Medical massage therapy achieves this clinical criteria because medical massage is not a general massage treatment. Rather, medical massage is applied as manual therapy to the specific area and the primary pathology of the patient's chief complaint. Medical massage is delivered to an anatomical region based on soft tissue and joint findings and after diagnostic palpation. Medical massage protocol involves several progressive steps or stages of treatment which attempt to correct abnormal conditions affecting the joint complex. Medical massage therapy is not limited to myofascial tissues but includes highly specialized joint complex and joint mobilization techniques. Medical massage adopts the medical techniques and protocols of other systems of manual therapy, such as physical therapy. Medical massage uses techniques and protocols for which there is current scientific evidence of their validity. The therapeutic massage community is still struggling with the public image that associates massage with illicit sexual practices. While this is not a popular area of discussion within the massage community, it is a problem in many areas of the country where illicit massage is openly practiced along with legitimate therapeutic massage. Another aspect of ethics within all healthcare professions is the use of validated and proven treatment practices. Incorporated within the relaxation or therapeutic massage community is a significant group of practitioners who practice scientifically unproven techniques. Some of these techniques fall into the category of fringe practices and create problems with the acceptance of massage therapy as a valid mode of healthcare within the professional healthcare community. Medical massage therapy is an allied health profession and a system of manual therapy. The men and women of medical massage therapy are dedicated to serving humanity with their minds, hearts, and hands. They have been educated in the principles of science and the art of using their hands to treat injury and/or disease of the soft tissue structures of the human body. In part, the ethical practice of medical massage therapy is also derived from the definition of medical massage therapy in a professional sense. The medical massage therapist has been specifically trained and prepared to work in association with physicians, physical therapists, chiropractors, and other healthcare professionals in performing the specialized techniques of medical massage therapy. Therefore, the medical massage therapist is also bound by the ethics of the medical profession. The medical massage therapist is trained and experienced in the treatment of musculoskeletal conditions related to injury, disease, or aging. The medical massage therapist is trained to work with clients of all ages, from infants to the elderly, both sexes, all races, and all manners of human status and conditions. The medical massage therapist adheres to these rules of engagement. 1. While the medical massage therapist performs soft tissue assessment and takes findings, the therapist does not provide medical diagnosis. 2. The medical massage therapist always insists on a medical diagnosis by a medical physician, osteopath, and/or chiropractor. 3. The medical massage therapist takes postural and soft tissue findings and treats the affected area in order to correct the abnormal findings. 4. The medical massage therapist refers patients to medical and chiropractic professionals for evaluation and qualified treatment. 5. The medical massage therapist works in cooperation with other allied healthcare professionals such as nurses, physical therapists, and occupational therapists. And 6. The medical massage therapist is a true allied healthcare professional who keeps patient care or treatment notes, maintains malpractice insurance, and behaves ethically at all times. When a patient presents with a chief complaint, the main reason they have come to see you for care, focus your attention on that complaint. Treat the exact region of complaint and center your therapeutic technique on alleviating the soft tissue dysfunction. Treat regionally, do not be a generalist. Focus your treatment like a surgeon cutting out a tumor. Your professional responsibility to the patient is to attempt to alleviate the patient's suffering. It is not ethical to experiment on your patients, but rather apply the techniques and protocols that you know will specifically alleviate their pain and correct the underlying problem. Medical massage therapy is not about you or your personality. It is about your professional and ethical responsibility to do everything you can to assist your patient. You do this best when you focus on your treatment techniques to the exact areas of dysfunction and follow the treatment protocols most likely to produce clinical rehabilitation. When you accept a patient and agree to treatment, you assume responsibility both ethically and legally for the treatment that you provide and its outcome. One of the ways in which the medical massage therapist differentiates him or herself from the relaxation massage therapist is through their professional demeanor, which is modeled after medical professionalism. Nowhere is this better represented than in the manner in which the medical massage therapist prepares the patient for treatment via the surgical draping procedure. The surgical draping techniques employed in medical massage therapy assure patient modesty and a sense of security for both the patient and the therapist. Surgical draping technique leaves no question as to the intention and the professionalism of the therapist. Some schools of thought in massage and some individual massage practitioners lack an ethical sense of patient protection and modesty. The medical massage therapist is not confused regarding this issue and will conscientiously guard the personal modesty of the patient. Surgical draping allows free and complete access to the area or region to be treated by the therapist. It also assists the therapist in remaining completely focused on the area of patient complaint. The medical massage therapist will master techniques that will facilitate patient treatment from supine, prone, side-lying, sitting, or standing positions. Not all patients or their conditions can be treated safely or effectively from the standard supine or prone treatment positions. The medical massage therapist learns to take soft tissue findings and apply treatment technique from any position of patient comfort. Total patient comfort and relaxation facilitates the overall healing process. A reduction in patient discomfort and apprehension during the treatment increases treatment effectiveness and encourages the patient to return for more therapy. Pain is not necessarily gain, and any result that can be obtained by increasing patient pain and apprehension can be overcome by an intelligent treatment with a pain threshold within the comfort level of the patient. Increasing the sense of safety and security in the patient is an important aspect of patient management and risk reduction in any massage practice. Let's look at some of the terminology and definitions that usually define aspects of professional ethics. Professional boundaries. What are professional boundaries? Professional boundaries define effective and appropriate interaction between professionals and the clients and patients that they serve. Boundaries exist to protect both the professional and the client. What is a boundary violation? Any behavior or interaction which damages the patient, the professional, and/or the therapy is a violation. It is the victimization and exploitation of a patient by the professional. It is a betrayal of the sacred covenant of trust. This includes sexual and non-sexual misconduct. Who is harmed by a boundary violation? Boundary violations harm the patient and the professional. The ramifications are widespread. Damage usually extends to marriages, families, other patients, communities, clinics, institutions, and the profession in general. Transference. Transference happens when a client unconsciously projects his or her own unresolved feelings, thoughts, expectations, and beliefs onto the therapist. If, for example, you resemble in appearance or mannerisms a parent with whom the client has unresolved control issues, the client may unconsciously attempt to control or manipulate you, unjustifiably direct anger or resentment toward you, or assume a passive childlike behavior. Countertransference. Countertransference happens when a therapist unconsciously projects his or her own unresolved feelings, thoughts, expectations, and beliefs onto the client. If, for example, the client's habits remind you of your own patterns of self-neglect, you may resort to judgment, preaching, or making excuses for the client's lifestyle choices. The following is a laundry list of the most common practices which may cause ethical and legal problems for massage therapists. 1. Claiming knowledge or skill in treatment that they do not have. 2. Claiming to treat or to cure conditions that they cannot effectively help. 3. Interfering with the relationship between the patient and their medical or chiropractic physician. 4. Diagnosing patient conditions or problems. 5. Failure to appropriately refer patients for medical care. 6. Selling patients products that they don't need and that will not help them. 7. Developing a personal relationship with a patient that crosses ethical boundaries. 8. Making personal or sexually suggestive comments to a patient. 9. Dating patients. 10. Unnecessarily exposing patients' bodies. 11. Inappropriately touching patients or assaulting them. 12. Filming or photographing patients while they are disrobed. 13. Sexual contact with patients in the office or outside the office. And 14. Performing sexual acts on the patient, such as masturbation. The performance of any kind of inappropriate sexual, sensual touch or contact with a patient is not only a clear ethical violation, but it is also illegal and a criminal act as well. The development of a personal relationship with a patient that extends outside of the office is also a violation of the Professional Ethical Code and the Code of Conduct. It may also be a criminal act if the patient later files a formal complaint against the therapist. So don't date your patients. Your relationship to a patient is strictly professional. It is not about you or your personal needs. If you see yourself as needing to develop personal relationships with your patients, to share your personal life and history, or if you view your patients as potential boyfriends or girlfriends or as sexual interests, you have a problem. You either need to seek professional help or to leave the massage profession before you harm your patients and yourself. This is a good time to listen to the professional oath sworn to by advanced members of the American Manual Medicine Association. I hereby pledge that I will keep this oath and stipulation. The medical massage practice that I adopt shall be for the benefit of all mankind according to my ability and judgment, and not for a disservice. I will give no drug to any, though it be asked of me, nor will I counsel such. With honesty and sincerity, I will pledge my life and practice medical massage therapy in service to my fellow men and women without prejudice or distinction of race, color, or creed. Whatever house I enter, I will go for the benefit of the sick, abstaining from all that is deleterious and mischievous. I will keep in strictest confidence all things revealed to me as a therapist. While I continue to keep this oath inviolate, may it be granted to me to enjoy life and the practice of massage, holding in high esteem those who have taught me this art, and to be respected by all. The origins of this oath date back to Hippocrates, and are paraphrased from the oath prescribed by this great healer. Certainly this oath speaks to the very heart of our individual and professional responsibility to follow the highest possible standards of personal and professional behavior and to become the moral guardians of our patients while they are in our care. When you make the effort to train, study, and practice to become a professional massage therapist, you assume the mantle of responsibility that this oath represents. There is a sacred responsibility that is a part of the inherent obligation of all healthcare providers. Healers since the beginning of time have recognized this obligation. This ends this introduction to professional ethics and law for the medical massage therapist. We hope that it will serve to uplift the conduct of your practice as a massage therapist and will help you to safely and effectively serve your clients, and patients.